A dietitian is an expert in food and nutrition. They're university trained and qualified in order to help people with diet and lifestyle choices to manage chronic health conditions.
Many people perceive that dietitians are only are good to help people lose weight, but we can actually assist patients and the GPs in managing different cases such as diabetes, cardiovascular disease, people who may have renal failure and may be on hemodialysis or peritoneal dialysis and require specific education. An example of this may be a patient who might need to follow a low potassium diet or a low phosphate diet. We also can help different patients and cases such as people with liver failure, people who might have allergic reactions to different foods and need to follow an elimination diet, and those patients also with eating disorders such as bulimia and anorexia nervosa.
So dietitians don't just manage patients once they've been diagnosed with a chronic disease. Dietitians are actually really critical in the prevention of the chronic diseases. So if a patient, for example, has impaired glucose tolerance or a high fasting blood glucose, a dietitian can be critical in the management of that patient's care so that they don't later go on to develop type 2 diabetes.
The work that we do with the type 2 diabetes patients when they come in is to ask them to maintain a food diary. And then once they bring in the food diary, we do a quick nutritional assessment on their diet. And after that, we are able to plan, depending upon what blood reports that they have, we are able to plan a medical nutritional therapy plan for them. And then we call them and do an assessment on the plan, whether they were able to follow it or not, and any barriers that stop them from achieving their targets. The case study that was presented was a man who 66 years old, 5'7" height, and he presented with fasting and postprandial high sugar levels, plus he had hypertension and cholesterol as well. In the 6 to 12 months period, what I did was to go through the diet and do a quick nutritional assessment on the diet, prepare a personalized care plan for the diet, suggest a lot of variety, modify certain recipes, but help him with his budgeting as well. And within the 6 to 12 months period, we were able to reduce his medication for his sugar levels as well as for his blood pressure.
My specific area of interest is nutrition in aged care. The majority of patients that we see in these aged care facilities and at home are basically patients who may be at risk of malnutrition or are malnourished. The risk factors for malnutrition include unintentional weight loss, poor appetite or changes in a patient's appetite, changes in a disease state. Patients may have swallowing difficulties, which may then lead to them reducing their oral intake and then obviously ending up with malnutrition. Depression and dementia can be another risk factor, as well as infection and surgery and possible hospital admission. Some of the consequences of malnutrition in the elderly include prolonged wound healing, increased pressure sores, reduced immunity, reduced muscle tone and strength, reduced mobility and an increased risk of falls. Prior to assessing these types of patients, we will generally liaise with their doctor to find out some more information about their past medical history, their biochemistry results, the current medications that they're on. In terms of what biochemistry results I like to look at, we as dietitians, we generally like to look at things like protein, their albumin levels, their iron studies, vitamin D, vitamin B12 levels, their kidney function and EUCs. After we've collected all this data, we obviously go out and do an assessment on the patient. And to be honest with you, most of these patients we find, in terms of their dietary intake, they're quite low in energy and protein and certain vitamins and minerals. So we basically put together a plan for them to help meet their nutritional requirements. And this may be by diet alone or could be with the provision of nutritional supplements.
I've got an interest in weight management, seeing my patients who may have battled with their weight over the years. A lot of them will come in typical classic yo-yo dieters over the years. They would have tried this diet and moved on to the next and so forth. Often, they do see some great weight loss to start with, often through unsustainable practices, and often the weight gain does tend to rebound, plus a little bit more, and then it leaves them clutching for the next best thing. Often when they've come in to see me, I tell them we've got to just get back down to basics, and I feel the technique of mindful eating is a really powerful way to get them started again. It's a really simple strategy, and it's a very non-stressful for them. So we always look at using hunger as the physiological sign for eating. Often when these classic yo-yo dieters are used to these set ways, they tend to eat according to what's in front of them on their list, rather than listening to their body. So we look at eating with awareness, and at meal times, non-hungry eating may include things like eating with boredom, eating out of stress, eating out of habit, or even eating out of wastage. We tend to be brought up to finish everything on the plate and to not waste food, so we tend to eat more than what we really need to. I find that with a lot of these clients, after seeing me and breaking down their old habits, they realize that moving on day to day, once they do eat with this mindfulness and awareness, they tend to eat a lot less in general throughout the day, because I realize that a lot of these times throughout the day, they are eating when they're not hungry. So their overall reduction in food intake helps them with some sustainable weight loss in the future.
People with polycystic ovarian syndrome or insulin resistance can really struggle to lose weight. Oftentimes these patients have tried everything to lose weight and they just haven't been able to. And that's because of the cycle of insulin resistance. And a dietitian can work with these patients to help them lose weight, to help them break through that cycle of insulin resistance. Getting a dietitian involved in the care of these patients can be really beneficial, especially if they struggled with fertility issues, if they've struggled with weight loss. So for those reasons, getting a dietitian involved can be really beneficial. To help these patients manage, we would really get them on a low glycemic index carbohydrate diet. We would make sure that the servings of carbohydrate they have throughout the day are not excessive, so we'd manage how many servings of carbohydrate they have at each meal. We'd make sure they're choosing low glycemic index carbohydrates, that they're choosing healthy fats instead of saturated fats. Because these things we know may be really beneficial in helping to break through that insulin resistance. I saw a woman about 2 years ago who was struggling with losing weight. She had a history of polycystic ovarian syndrome, and she was really keen to lose weight so that she could fall pregnant. This woman had tried everything to lose weight. She had tried diet, she had tried exercise, and she just wasn't able to lose the weight. She came to see me, and what we did is we really managed how many servings of carbohydrate she was having at each meal. So we maxed her out at 2 servings of carbohydrate at each meal. We recommended that she chose low glycemic index carbohydrate foods. And so she really adapted to that. She started eating low GI carbohydrate foods. She had 2 servings at each meal, and she came back and was able to finally lose weight. She later went on and was able to fall pregnant, which was really exciting. She's lost the weight, she's kept it off, and she feels great.
Best way to probably make a referral for a dietitian is to jump on the Dietitians Association of Australia. You can locate a local dietitian in your area.
The different referral pathways that the GP can use to refer the dietitian is through the Enhanced Primary Care Plan, which is called as EPC. The other one is there are specific group sessions for type 2 diabetes, which is in addition to the normal EPC, DBS, and through private health funds or just private referrals.